As PS Kenya, we are experts in social behavior change communication. We understand that there are different ways of approaching different people. We do not use the same strategies to reach Elijah and to reach Wanjiko. Our strategies are very different and very custom-made towards reaching this specific target audience. We are very dependent on data, we are evidence-based, and we look at information. For example, if you're looking at cancer, which is now a big burden in this country, and we have seen that there has been increasing cases, so we identify pockets of areas where there are very high cases of cancer, and we target towards ensuring that we are reaching this population with the correct messaging. The channels that we use towards reaching this population are very, very different. For example, above the line, we use media, national media, on TV, on radio as well. And also we go directly to the households at grassroots level. Yes. We work with community health volunteers. And I would like to thank the government for the initiatives and also for the policy space that they have given this country, the policy direction and coordination of many partners who are working towards this space. So we train community health volunteers depending on that behavior that we want to change. Let's take the example of skilled delivery. We've seen many women delivering at home. If we want to change that behavior and help mothers towards improving or to deliver in a health facility, skilled delivery, to increase the chances of their survival and also the chance of their children surviving when delivering in a properly skilled health facility that is equipped, that has proper healthcare workers that are able to take care of them in case of any emergencies. So we train community health volunteers, and these community health volunteers are recruited by the local community. They are identified as local leaders by the community, and once we train them on skill delivery and give them very practical things that they can do, they move house to house. This is an army, an entire army in this country. So they move from house to house and they're able to identify. They know that in this house, this lady is pregnant. So once the lady is pregnant, very early in their pregnancy, let's say, for example, by 5 months or as soon as they get to know, they visit her at home and have that conversation with her. What's your plan? When do you plan to deliver? And where would you like to deliver? So they walk that journey with the woman and help her come up with a birth plan. If she chooses to deliver in the local health facility, the community health volunteer will plan with that mother when they can go together to the health facility months before she delivers. Yes. They also help her towards ensuring that she's attending the recommended antenatal care, so that in case of any issues, if there's any emergencies or any discrepancies that would be found in the pregnant mother, these cases can be caught very early, and this increases the chances of survival for both the mother and the baby. There are also supplements that a pregnant mother needs to be given so that she's strong enough and also to prepare for her delivery, because she's going to lose a lot of blood. So we link them very closely with the local health facility, so that they are able to get all these resources, counseling, also to get the required medication directly from the health facility. All the work that we do is really confined by what the government of health, what the government and the Ministry of Health, the government of Kenya does. So again, we also work at the national level, policy level, where we help in developing proper policies in collaboration with other stakeholders, so that these can go directly to the household.
Which was actually my next government. It's a good thing that you're touching on it. Again, when we look at the healthcare landscape in the country, you will say that policy is not lacking. When you read through that, it was beautiful on paper. The disconnect begins then translating this policy into actions then that can streamline the particular sector that they're meant for. In that regard, Dr. Margaret, would you first confirm that Kenya's healthcare policy is one of the best on paper? And then the question then becomes, do we need to change how we apply this policy, or do we need to change policy entirely?
I want to confirm that we have the best policies. Actually, other countries in the region, they benchmark with us. They keep asking for, in terms of policy, exactly, yeah. They ask us, Kenyans, what do you have? What do you have? What policies are these that you have? And particularly in health, because our capacity is very, very high in the healthcare space, our policies are top-notch, and other governments, other countries, they come to us to find out how we have been able to have such cutting-edge and top-notch policies as well. Also, our experts, there are many experts who are in country, who go to other countries to provide that technical expertise in policy development in other countries.
Yes.
So in policy, we are doing extremely well. Implementation of those policies is where there is a gap. The reason being, implementation of policy requires resources. Resources are limited, and there has to be prioritization of where these resources would go to. So that's where other partners like PS Kenya and other NGOs and other players come in to support the government in implementation of these policies. So some of the work that we do is, once policies are developed, guidelines are developed at the national level, we support in passing those policies down to county level, conducting trainings, increasing awareness, and facilitating that piece and ensuring that there is proper coordination towards the implementation of the policies. So indeed, there is a big gap in implementing policies in this country, and there's still a lot to be done towards getting us to realize and to implement that policy. And